Good evening and welcome to tonight's edition of The Probe. Tonight, 2 more lives have been lost to the coronavirus disease, according to the Ghana Health Service. Now, this brings the total number of deaths recorded in the country so far to 799. As of July 6, a total of 1,982 active cases were recorded in 13 regions. New cases recorded stand as 159. The 3 regions that have not recorded active cases are the Savannah, Upper East and Upper West regions. Now, out of 97,130 confirmed cases, 94,349 patients have recovered and have been discharged from various health facilities. Now, 23 of the cases recorded are said to be severe, while 11 others are regarded as critical. So this is our COVID situation as a country. So it appears we are recording a steady increase in COVID-19 cases. Tonight, we probe what may have triggered what many suspect is a 3rd wave in Ghana and what has become of our quest to vaccinate 20 million people by close of 2021. Can we still attain herd immunity? How are we hoping to fight the Delta strain in Ghana? These and many more questions you sent in already are begging for answers from Presidential Advisor on Health, Dr. Anthony NSIAH ASARE. He's my guest tonight on The Probe. He will answer all your questions. If you haven't sent in your questions already, please send them ahead now to 054 010 9009. Also on all our social media platforms, you can leave your questions there. You, my guest tonight, will stay here on The Probe. I am Emefa Apau, and I'm sure you're wondering whether it's going Rome or home. I'll give you updates as well. Welcome to The Probe. Thanks for your company tonight and welcome once again to The Probe. I'll go live to Zoom at this point and welcome my guest for tonight, Presidential Advisor on Health, Dr. Anthony NSIAH ASARE. Thank you very much for your time here tonight on The Probe, sir. You would have to unmute once again. I'm unable to hear you. Okay.
Thank you very much, Emefa.
Great, wonderful.
And good evening to everybody.
Thank you very much for your time once again. So that once we have all clear now, the last time we had you here on The Probe, issues about people who attended the Sir John funeral came up, and we mentioned that most of them were being monitored amongst others. It's come up in the number of questions I've received. They're asking how far with those who have been monitored, and whether those who also attended the Hearts Kotoko March have also been monitored. Whilst you chew on that, I would first want to find out what kind of advice you are giving the President as his advisor based on the science and data about COVID-19. What do we have?
Yeah, thank you very much, Emefa, and good evening once again to our cherished viewers and everybody watching and listening to us. Yes, the advice we've been giving to the president is that we are not out of the woods yet. See, once you have a 3rd wave or 2nd wave in any part of the world, and more importantly on the African sub-region, it means we are not safe. Because the world is a global village, and people move from one area to the other area within hours. And as you are aware, we have countries in our sub-region who are now struggling with the number of people who are getting the COVID-19, and some of them succumbing to admission and also even death. So we are also potentially have to wait and watch and be careful about having another wave in this country. But the most important thing, either it's a Delta, either it's Alpha, either it's Gamma or anything, what is important is the safety protocols, and also get a lot of people vaccinated as much as possible.
Okay, these are questions that we'll be getting into in terms of the timelines with vaccinations, among others. But we've had people asking and wondering, I've been wondering also, how come we haven't had any presidential address in a while, especially when we've recorded Delta cases and all? Is there a particular reason why? I don't know if you're able to speak to that. How come we haven't heard from the president? The usual Sunday evenings hasn't happened in a while.
Oh, there's no particular reason for that, but the president will be coming out very, very soon. That's what I'm also talking to you now. That's what Ghana Health Service also does a regular updates, and the Ministry of Information also give updates. So it all comes together, and His Excellency the President will then give a very strong policy statement and also advise all of us and admonish us. So he will come out very, very soon. Okay. I know you're talking about the very famous fellow Ghanaians. It will be coming out very, very soon.
Okay.
We'll have another one.
Well, now we'll get into the questions we've received, but the very first question I asked earlier was the latest on the persons that you mentioned that were being monitored, those who attended Sir John's funeral. You mentioned that they were being monitored. Do we have an all clear? Do you have an update on what you found from that monitoring?
Yes, the Ghana Health Service surveillance team put up a very strong surveillance, especially at Sakra Ono, where Sir John comes from. They tried to find out if there will be any surge or any outbreak of an unusual cough or any COVID-like symptoms in the municipality or in the vicinity of Sakra Ono. God being so good, they looked for about 4 weeks. There was nothing like that. It's not been of anybody also who went for the funeral who has tested positive. Because we know people, when anybody tests positive, we know where the person is coming from. So they were followed for about 4 weeks. Even they did more than 4 weeks, about 4 to 6 weeks. You remember that since the funeral, it's about 2 months now. And nothing untoward happened, especially to the family of Sir John. Because anybody who went there will go and commensurate with the family. And that's where the contact is very close. None of them and nobody from that place have been reported as having a problem within about 4 weeks of the funeral. So that's what has happened so far.
Okay, so issues about vaccinations. The first batch, those of us who had the first jab, we fortunately got our second jab. There were those who also took part in that first inoculation that are still yet to get their second jab. Earlier, we were told that 8 weeks is okay. Now, 12 weeks was okay. Now, we've passed the 12 weeks. They're asking what happens to them.
Yes, what I'll say is that I'll give you the performance of the vaccination so far so that we can get it from them. So far, a total of 1,265,106 doses of vaccine have been administered to Ghanaians. Out of this, those who have received their first dose is about 864,964. This is as at 5th of July. And so far, we have vaccinated those who have had their full 62 doses of.
Oh dear. Okay, it looks like we're just losing that connection to Dr. NSIAH ASARE there. He's joining us from all the way from Kumasi, but he's been giving us updates on the vaccinations done so far. So the figures he put out earlier, as at 5th July, 864,964 persons had been vaccinated. He's going to attempt to respond to those who are yet to get their second jab because most of us got it in the first time, but some of you did not. But he's been giving us that update. Thankfully, he joins us back on the line. Dr. NSIAH ASARE, sorry we lost you momentarily. So you've been giving us the update on those who have been vaccinated. That's fine. Please go ahead.
So we have those who have received their 2 doses, 400,342. So we have 464,623 persons to be vaccinated to get their second dose. And that's what we are working towards, that to make sure that we get these people vaccinated so that at least all the 864,000 and over will receive their full coverage so far as AstraZeneca is concerned.
Okay.
But I'll quickly add that since the last time I spoke to you, we've been able to also add more vaccines to the number of vaccines that we can give in this country. As I said earlier, if the vaccine is not given emergency use authorization by Food and Drugs Authority, we don't use it. But so far, I'm happy to also say that we have five vaccines which have received the Food and Drugs Authorization, emergency use authorization. We have added on over the past 2 weeks, we've added the Pfizer and also Moderna to the list that we have. So now we have AstraZeneca, we have Sputnik V, we have Johnson & Johnson, we have Pfizer, and we have Moderna. Another good news is that Ghana Health Service, the Ministry of Health, for that matter, the government of Ghana has improved the cold chain system that we have in this country. So we are ready to receive Pfizer and Moderna. Moderna is about -25, Pfizer is -80. So as I speak now, we have deep freezers, ultra cold freezers, which can store these vaccines. And luckily, the drones distribution centers, 4 drones distribution centers in Ghana, at Manako, in Panya near Mampon, Fopsi near Walewale, and Sehuyo also have -80-degree fridges, and they are helping us to also distribute these vaccines to the rural areas. So we can now receive Pfizer for distribution. And we know that through US government, through the president, Joe Biden, has recently given African Union about 5 million doses of Pfizer, 10 million doses of Pfizer, and 5 million doses of Johnson & Johnson. I'm also happy to say that Ghana will be receiving about 1.2+ million of Pfizer soon, very, very soon, so that we can have our second deployment phase with Pfizer. We are working around the clock to get another few doses of AstraZeneca to be able to complete the first deployment phase that we did for the about 464,000 people to be vaccinated. And hopefully we'll get more from all the other sources that we have put in place, both direct from government to government, multilaterals, from African Vaccine Alliance Trusts, and from African Medicine Supply Platform, and also from COVAX. And Ghana government is also going around trying to also use government to government to bring in vaccines that we have given emergency use authorization in Ghana. So far that's about the vaccines. Okay. And when the time comes and the vaccines are in, we will let everybody know. And what we want to do is that people should be ready and they should make themselves available to go for the vaccination when it's announced and where we are going to give it.
So that's some good news that you're putting out there. But for this 464,000 that are supposed to be taking their second jab of AstraZeneca, is there any good news for them? When exactly are we taking the next stock of AstraZeneca so that they can complete the jab? Because the last time we're told that 8 weeks, then it went to 12 weeks and it's passed. So they are asking when they can take their second jab.
Yes, very soon, because you see, it is now known that for AstraZeneca, for any vaccine, the longer you wait for the second dose, the better. That's what is coming out now. COVID-19 pandemic has brought out a lot of things. It's a novel, that's why we say that it's novel virus. People don't know. In fact, anybody who has given the virus, the earliest time was, I think, in January or late December, that people started giving the vaccines. So we are now learning, everybody is learning. So I will assure everybody who is waiting for the second dose that the first dose is still working. When you give you the second dose, it is now even known from studies done that the booster will even increase your immunity sometimes better than when you take it immediately after the 8 weeks. Okay. That's why it's 12 weeks. And now there's a new study but we will not go beyond. We are hoping that within the next few weeks, we'll get also at least this number of doses for those with their second jab. Okay. And then we can then continue from there for the second deployment, and the third deployment, and the fourth deployment. But we are still hopeful. We haven't changed our stand on the 20 million target that we said. And I know you asked me a question, but I know the reason why I'm saying that is that from the third, and now we have all seen, from the third quarter of this year to the end of the year, the fourth quarter, there will be a lot of vaccines made available for the whole world to use. Okay. And that's what we are banking our hopes on.
Well, so apart from AstraZeneca, you've mentioned that we're getting Sputnik, Moderna, Pfizer, and then Johnson & Johnson. Do you have any timelines as to when we are receiving all these?
What I know for sure is that we'll be getting the Pfizer very soon. Okay. What I also know is that by the end of this month, in early August, there will be another batch of also vaccines coming. The ones which is coming from the United States government, if you have been reading from the net, you realize that Ghana has about 3 sources that you get the vaccines from. The first one is the 50 million that they're giving to African Union. We are getting our share. And that's why I said that we get about 1,260,000 doses. The next one is also direct for priority countries. Luckily, we are among the 5 countries that the US government treated as priority countries. It's all from our vaccination records. So we'll get another doses from there. It may be Johnson & Johnson, maybe some Pfizer. And then there's a third one, which is about 45 million, which will be going to COVAX. And since we are among the AMC, 22 AMC countries, we also get a share from the COVAX, the actual COVAX donation that will be shared among the countries. Apart from that, the African Medicine Supply Platform and AVAD is also sourcing AstraZeneca, sourcing also Johnson & Johnson, so that the African Union will then sell it to all countries. And that's what every Ghanaian wants. Ghanaians want us to get it from either bilateral or multilateral and not depend so much on middlemen.
So I was coming to that, whether exactly in all this, whether we are dealing with middlemen, because we know about the Sputnik situation and we're told that government is now pushing for a government-to-government agreement. Is that the case now, or we're still dealing with middlemen?
We are very cautious, but where it is necessary to get, for example, we need about 464,000 doses of AstraZeneca. You cannot wait till eternity to make sure that you get AstraZeneca. If we get somewhere from a middleman, which is is a very right source, the price is within the price that we have set ourselves, why not? The most important thing is vaccinate as quickly as possible to achieve herd immunity so that the mutation of the virus will not take place, and then we'll get all sorts of variants into the country. Okay. That is what we are trying to do.
Well, briefly though, still on vaccines, are you welcoming the parliamentary probe on the negotiations and the controversies around the Sputnik, especially with our involvement of middlemen?
Yes, we are welcome to that. We are ready. And I'm sure the Minister of Health has prepared to meet them. If they call any of us to give any insight into what the vaccine politics, it's the global vaccine politics, the geopolitics of vaccine, we are prepared to give to everybody. You know, what is happening now in the world is that now we have even heard that Pfizer is saying maybe you need a third dose. And the question that everybody is asking is that this fight, this pandemic, cannot be fought by only one single country or one single continent. It's a global fight. And we can all fight it together if we all receive at least, if for nothing at all, a dose each of every vaccine that is in the world. Then we are there. So that's what we have been doing, that look, let's fight this thing together. And I'm very happy that African Union, the leaders in African Union, especially the heads of states, having taken this one straight on and fighting it. And then we have said that it shouldn't happen anymore, that we have to prepare ourselves very well for pandemics, and preparing ourselves for pandemics, especially viral pandemics, is also trying to also make sure that we make our countries or our regional hubs have a place where we can also produce our own vaccines. That's the reason why His Excellency the President formed a committee to go and bring out a blueprint for Ghana to be able to develop and then manufacture our own.
It appears we haven't heard from that committee at all. One wonders what exactly that committee has been up to, led by Professor Kwabena Frimpong-Boateng.
The committee is working around the clock. The meetings are going on, we've gone very far, and very soon, I'm sure His Excellency the President, who formed the committee, will come out to tell Ghanaians what the committee has done so far.
Are they telling us when we are starting production locally? Do we know?
His Excellency the President will come out and tell us. I don't want to take the wind out of anybody.
Okay, we hope so. That will be soon. Let's get into the batch of questions from our audience at this point. So this one from Kweku on Facebook says, why did it take so long to fully test staff and students of Achimota School? And up till now, many parents of students have not been tested. Are we not risking further spread? That's according to Kweku, is asking. Appear on WhatsApp says, what's the backstory on the detection of the Delta variant in Ghana? How long was it in the system before government announced it? That's according to Appear. And we stay on WhatsApp. Labi says, our intensive care units are getting full. Are there any plans for alternatives? Okay, so that's the first batch of questions. So Apia is asking what the backstory of the detection of the Delta variant in Ghana was and how long was it in the system before it was announced to us as a people?
Yeah, as you know, you remember that in April, the West Africa Cell Biology Project in Legon and the University of Health and Allied Sciences in Ho, and also Noguchi have been running a series of genomic sequencing tests. And they've been running it since last year. So in April, they brought a report where we have 6 arriving passengers, international arriving passengers who tested positive for the Delta variant. They were luckily, if anybody is coming out and you test positive, you isolate you and they manage you when you are negative before you are left out. So they continuously been testing. And June, when they did the June one, they then realized that there are about 30, another, I think 34 or so, or 17 people. No, 20. They did a 20 tests from Hashimoto samples, 22 tests, and 20 of them were positive. That's why everybody became alarmed, and also had about 7 in other communities. So far we have about 34 Delta confirmed Delta variants in the country. But the most important thing that they run this genomic sequencing over the time. The most important of variant of concern. You know, the WHO has variants of concern and variant for information. And they name it after the Greek alphabet, alpha, beta, delta. The most one is the alpha variant, which is the UK strain. And the another one is beta, which is the South Africa strain. And then we have the, I think the gamma, which is the Brazilian strain. And then now the delta, which is from the India. That's the country where it originated from. So we realize that we have at least what they've run, the tests that they've run so far, they are still running. I think tomorrow or in the course of the week, they'll come out with another results that they have done. Immediately they do it, they advise Ghana Health Service. Ghana Health Service then informs the task force, and then we start making sure that it is done and then managed very well. What it means, initially in April, it was from international travelers. And then in June, when the results came out, and we realized that it has gone into the community. But we knew from April that since some people have brought it into the country, it's most likely that there will be 1 or 2 people who are incubating it, but they were negative at the airport. So that even though they are advised, if you don't wear your mask, you don't follow the protocols, you can also infect people. So the most important and the most dominant variant in the country is the alpha variant from the UK. And then now we have this new Delta variant in the country. The test, the genomic sequencing is still ongoing. It's a continuous thing that they are doing. So we want to know exactly what variants we are dealing with since we started seeing patients here on the 12th of March 2020.
So the Delta variant...
So it wasn't that we saw it.
Okay, so Delta variant has been with us. So it's been with us since April, you're saying, because we were told that it was at the airport and it has been contained. So the question for many is, how did it get into the community? Have we been able to tell?
Yes, when it comes to the airport, you know that we all know that the COVID-19 was imported into this country. That's the source. So any new variant coming will be an importation from outside. So we saw the 6 of them. Those 6 were contained, they were isolated, managed, and they discharged when they got well. It means they cannot infect other people. But as I said, the testing that we are doing, both the testing and also the PCR, 72-hour PCR test, are things that we have put in place as a country to limit any imports into the country. And the word is limit, it's not eliminate. If you want to eliminate, it means you have to quarantine every passenger who comes into the country. And you are aware that it's going to be a nightmare. We cannot do that for because we get about 1,000, 1,500, 1,700, sometimes 2,000 passengers a day. So what we do is that we do the instant test, 30 minutes, you get the results. Anybody who is positive is isolated. So if you get a Delta variant, or you get an alpha variant, or beta or epsilon or anything variant from it, we will then isolate the person.
Okay.
The rest who are negative are followed.
Well,
until the time that we got the June results, and then we realized that there are people within the country, not only in Achimota alone, but also in the community from some other districts who have also tested positive to the Delta variant.
Okay.
Then we then announce that it's community spread now.
Okay.
So
but is it a situation we should all be worried about now that it's in the community? Is it a situation we should all be worried about? How widespread is it, Dr. NSIAH ASARE?
We cannot tell how widespread is it until they finish or they continuously be doing the genomic sequencing. But the most important thing is that either it's alpha, beta, or delta, we should all be worried about any strain which is coming into the country, especially when we know that the Delta variant is very transmissible, very virulent, and people die and get very ill and overwhelm the hospitals. So the most important thing is everybody, until we are all immunized or we have the herd immunity, the most important thing is the safety protocols that have been put in place, which is not difficult to do.
Well, at this point, I'll plead with you to give me a quick response so we can go through a number of questions. There are a lot of them. So there was one from Kweku that's asking about how long it took to fully test staff and students of Achimota School. And up to now, how many parents of students have been tested, and are we not risking further spread? So maybe you can lump it all together and give us the situation at Achimota School.
The most important thing about a cluster, when you have an infection there, is to first get the positives and do contact tracing and test them. So we started with 3 patients in Achimota. We tested them, tested the immediate contacts in the house and in the classrooms, and then we tested where they've been to. Anybody mentioned their name is tested. So that's how it is done. Not that you go to the school and test everybody. If you test everybody today and the person is incubating it, after 48 hours, the person can still infect somebody. So the most important thing is do a proper, that is the proper epidemiological things that we have to do. You know the contact, you follow the contact, you test the contact, and you continuously be doing that. Then later on, they were all boarders initially. Then we then realized that we have to then get the day students who are coming in, because they come in and out, so they were tested. And every day student who have been tested and tested positive, the parents and then the households have also been contact traced and tested. That's how it's done. So it's not a time that we wasted time and then they are reinfecting. No, Achimota's situation, so far as we know, is well contained. If they were all boarders, by now, everybody will be okay. But even the cases are going down. For the figures we are seeing, we are not seeing so much people from that area.
Okay. Well, so there was one also about our intensive care units getting full. Are there any plans for alternatives? Because today we're also hearing about the situation at 37.
The number of active cases is going up.
Please go ahead. We can hear you.
Once the number of active cases are going up, once the number of severe cases are also going up, and then the critical cases are going up, the intensive care will become full. So we've realized that we've moved from about active cases of, on the 23rd of June, we have 1,412. As we said, on the 6th of July, we have 1,982. It means we are increasing in active cases. So these are the people that we have to take care of. At one time, we had only about 3 critical care patients. Now we have over 11 critical care patients and 23 severe ill patients. So definitely, if you don't follow the protocols, we don't go strictly by the protocol that we put in place, and people continue saying that, oh, the disease is gone, everything is over. No, then we go back into a system. That's why I say that we are in a potential third wave, because there's a third wave all around us. So we have to be very careful.
Well, there's a quick one, a question on the back of the airport situation and the importation of the Delta variant. One is asking, so how effective is the airport screening then? Because Dr. NSIAH ASARE and his team give full assurance of the detection and containment of all strains at the airport. How do you respond to that?
Yes, we've tested about 349,284 passengers at the airport. And so far, we had 1,933 positive cases. These are potential people who have come into the community if you don't isolate them. So we still believe that We have done something at the airport which is unique, which every country is looking at why Ghana has done that and Ghana is not seeing what other countries are seeing. So we still insist that airport testing is unique, it's very important, and we should cherish it.
Okay, we'll get into the next batch of questions that you've sent us via WhatsApp and then also on our social media platforms. Leila is saying on genome sequencing, how well are we doing with that as it informs us about the type of the virus circulating within our population? That's from Leila. ASARE says, how is our testing regime so far? Are we testing as we used to? Isn't our current numbers a complete underestimation of people who may really be positive? That's ASARE. Kekeli says, how concerned is government about the continuous flouting of the preventive protocols, especially government officials, including the president, have been faulted in this regard? How then do they come back to tell us to adhere to same? Kekeli is asking. Okay, so if you want a few of them there that we can get into. Sarabia is asking about our testing regime. Are we testing as we used to? Isn't our current number a complete underestimation of people who may really be positive? Dr. Nsiah is there?
Yes, I'm there.
Okay, so
if I think, yes, I got a few of them. One is asking the genomic sequencing.
Okay, so that's Leila. How well we are doing with that, because it informs us about the type of virus circulating within our population. So briefly, you can speak to that, and then we'll get into Asarabia and Kekeli's question as well.
Yes, we are doing very well with the genomic sequencing. Yeah, can you hear me?
Yes, we can, Doc.
Yes, we are doing very well with the genomic sequencing. As I said, Noguchi is doing it, WASP is doing it, and then we also have the University of Health and Allied Sciences. They are continuously doing the genomic sequencing. As I said earlier, this week, today is Sunday, so this week they will come out of another batch of the tests that they've done. So far, they've done a lot of tests since last year, July, till date, and they continuously been running the tests for us. And that's why I was able to give you the most dominant variant, which is the Alpha. And then we have about 3% of whatever they've done, which is the Delta variant from India. So they are doing very well, and we have to make sure that we commend them for what they are doing. Okay. He's talking about the preventive protocol, that people are not following the preventive protocol.
How concerned government is, especially when we have officials, government officials, including the president and the others, being faulted in this regard. How then do you come back to us to adhere to same?
Yes, we adhere to same. People say the president and some government officials are not following the protocols. Yes, maybe you can talk about social distancing at where they went to. I'm sure you are talking about the famous Sir John's funeral.
Not just that, I'm sure that after that we've seen a few also. So
yes, but what you notice that anywhere His Excellency the President go or any government official goes, they are fully in their mask. They do the sanitization and they also wash their hands when there's water and soap there.
So there's no need for social distancing. There's no need for social distancing. Is that what you're telling us?
There is need for social distancing. There are some areas where sometimes social distancing becomes a bit of a problem. For example, the markets. For example, in Trotro. For example, in VIP. It is a problem. But socioeconomic life should go on. What we are entreating everybody to do, once you are in these areas where you cannot maybe prevent yourself from complete social distancing, at least be in your mask. At least have sanitizer in your bag or in your pocket so that you continuously be sanitizing your hands. One important thing that we have done in this country, which is very good, is that now nobody shakes hands again, at least in the public. I don't see it. Nobody hugs again. So these are some of the things that we have to follow. And once you do it, yes, it is difficult. We've realized, and we are coming out very soon because we are working together with the House of Chiefs. We have also met the clergy. We are meeting a lot of people who will come to you, to all our sisters, to see what you can put in place to make some of our social activities work. Because I'll give you an example, funerals. Funerals is a complete economic activity, socioeconomic activity in this country, apart from, because there are people whose livelihood are on funerals. Those who do decorations and all these things. They are, either we like it or not, there are some people who will make sure that, why don't you have a very decent funeral? But the most important thing is that if it is not done in an enclosed area, if it is done outside, we have to look at the risk so that we can then come with a protocol where people will sit, social distance, wear their gloves, their mask.
I hope you are not forgetting about the restriction in place when it comes to funeral, because that has not been lifted. I hope you are aware of that.
I know there's a restriction in place, MFA, but after all this, when we do and we get the proper protocols for it, then maybe that restriction will be relaxed a bit so that people can go about. Because the whole idea is that, MFA, we want to move and do things and move back into our normal socioeconomic life. The country has to move on. But the most important thing is that we do this thing in combination with vaccination. So immediately we have vaccinated quite a number of our people. And we believe if you continuously do a very good vaccination and get the good numbers in the very hotspots, we break the transmission in that place. And then, because as we speak now, there are about 3 regions in the north part of the country which have 0 active cases. I'm sure if you look at the records that you have.
I mentioned them earlier. And then the Savannah.
So these are some of the things.
Okay, so Asarabia is asking.
And make sure that people follow it.
Okay, so we'll go through a number of our questions also. Asarabia's question has not been answered. She's asking how our testing regime is so far. Are we testing as we used to? And isn't our current numbers a complete underestimation of people who may really be positive, she's asking?
Yes, maybe he is thinking that we'll be doing the same testing that we used to do before when we wanted to know the dynamics of the virus, where we're doing enhanced contact tracing and testing. This pandemic, you cannot go, and I don't think any country has gone and then start testing everybody. It's not feasible.
Okay.
So what we do, anybody who presents of signs and symptoms, we test the person, test the contacts, and continue testing the contacts of the people who have been having the illness. If the testing regime, you think that we are not testing or we're not doing very much, you see it in our health institutions. You see our hospitals be full, even though people are not being tested, people are getting sick. So that's what gives us information that either the testing is going on or not. But I can tell her that we started with 2 testing sites, Noguchi and KCCR. Now, as we speak, we have 43 testing sites. Almost every region or every sector has a testing site. With the private sector having about 20-something out of it. And now we have a lot of testing sites in hospitals, in the regions, almost every region. In northern region, we have about 2 or 3 testing sites. Then we have some in northeast, and then we have some in northwest. So we don't carry samples from regions to regions as now. Okay. So anybody who wants to test can walk and go for a test. We also have brought in also the fluorescent antigen testing, like what is in the airport. So we have 2 types of testing going on, and the total number of laboratories doing testing is about 43. The last time we did a count.
Okay, well, I have a few also that we'll get into on the screen as well, but this one is also coming in on WhatsApp. He's asking whether why we are reluctant to, at least restrict incoming flights on risk basis. Why are we reluctant to do same in a resource-constrained country like ours?
Yes, we've been thinking about it. So if you want to restrict incoming flights, which flights are you restricting? Luckily for us, countries like India, where they have a problem, they've also restricted their citizens from going out. But a lot of people move from one country and then they transit in another country and come in. That's the reason why we have the 72-hour negative PCR test, as well as at the testing at the airport. And that one minimizes or limits this risk that we are having.
Okay, well, let's get into the ones that we have already also, then I can do the live ones as well. This one from Ifia, the education and everything about COVID-19 has gone down. Why? She's asking. We have more?
Yes,
I'll get to you shortly. I'll get to you shortly, Dr. NSIAH ASARE. Fred is asking what's fueling the current surge. when are we taking delivery of vaccines? Does he think it's time to tighten restrictions now that the third wave is imminent? That's from Fred. And Lucy says, there are reports all our emergency beds are full with our cases rising. Are we in a third wave? Israel says, what's the plan with communication on the protocols going forward following the Sejo funeral saga, considering the number of people citing that as an example? Okay, I'll take this final one for this batch from Evans. He says, it appears the supply of PPEs have been limited to Accra now that COVID-19 is dying down outside Accra. What steps are they taking to ensure supply to some of these hospitals outside Accra? For example, nurses at the Adidome Hospital say they are forced to buy PPEs. So I'll start with Fred's question, Dr. NSIAH ASARE. He's asking what's fueling the current surge that we have. You've talked about the delivery of vaccine, and he's asking whether you think it's time to tighten restrictions now that the third wave is imminent.
I think we will continue with the restrictions that we have and then educate people for people to follow the restrictions. We have to tighten it in the way of education. I don't know why he's talking about tightening. If you allow, you say that the police should arrest everybody who is not wearing masks, a lot of people will go to jail.
Because you know that you've been flouting too as the government officials, so it will be difficult for that to happen, wouldn't it?
So we will continue the education. And education, we have asked the Minister of Information and then Health Promotion Unit and Education Unit of Ghana Health Service to also now strengthen the risk communication and education of people. That's what we are all here doing. And then we entreat the media to also assist.
And what's fueling the current surge? He's asking because a month or so ago we had low cases, but it appears now we're getting a steady increase in our cases. And Fred is asking what you think could be fueling it.
What is fueling it is that if we've all gone to sleep, there's fatigue. Everybody is fatigued in following the protocols. So if you all wake up and then follow the protocols, it will bring the numbers down. That's the most important thing. It doesn't matter what type of strain it is. So please, let us all follow the protocols. Everybody, if for nothing at all, you wear your mask and then use sanitizers. If you don't have to go to a place, if there's even a funeral or there's a mass gathering somewhere you don't go, you are not forced to go there. Just don't go there. If you all do that, we'll be having a very good and then bring the figures down. The next thing I think the next question is about PPEs. Yes. I know that the PPEs are there. So if Adidome is not getting PPEs, we will inform the Ministry of Health and Ghana Health Service to make sure that Adidome, no health worker should buy PPEs to use in the hospital. They are giving free of charge. So we'll find out what is happening, why they are not getting it. And the emergency,
emergency beds, ICUs, we are told, in dire constraints amongst others. We've heard about the situation at 37 today, for instance. What really is the state of our ICUs from where you sit?
Now we've increased the number of ICU beds, a number of critical beds that we can use for severe and critical patients. And I believe that in Accra and Kumasi, where we have a lot of cases, the case management team have to look at all these things and make sure that they can redistribute the patients among the beds that we have. And so we are also looking at that. Fortunately, a lot of staff have been trained. We have opened up a lot of treatment centers with trained staff. So once you have a treatment center and you train the staff, they can take up most of the moderate to severe cases and then leave places where they need ventilation and the rest for the critical patients. So this is something that we have to do. We'll be meeting about it maybe tomorrow or tomorrow next to find out the number of patients, the number of beds and everything, and see how we can redistribute them.
Well, it brings up, before you get into the next question, before you get into the next one, Dr. NSIAH ASARE, the issue about ICUs brings us to the question about the hospitals that were promised that were going to be built. The last time we're told that issues about land and all that had come up. What exactly is the state of these regional hospitals and district hospitals that were promised?
As I know, all these land issues have been cleared. And the contractors will soon be going on site. We will let Ghanaians know when it happens. It will happen very, very soon.
You're giving us too many very soons on this show tonight. At least you can give us some concrete news on this particular one.
If I'm not this, I think before or by the end of this month, we want to make sure that the contractors, at least for the district hospitals, will go to site. That's what we want to do, because it's important for us to have enough beds in the country for every region and for every district, so that every district, every region will have at least some few intensive care and high dependency care areas, whilst we get places for our numerous nurses and nurses who are at home to go and work. So government is still key on the agenda 111, and government is working around the clock. We are working. You see, if you want to build a house, sometimes you stay in your room, put all things together, and then move to the field, and then you see it happening. So it's going to happen. That one I can assure you. By
close of next month, we should see something concrete on the ground. Okay. Well, also, you've been mentioning that I think Kweku also had a question, but Ifia was giving us also a question on the education, and everything about COVID-19 has gone down. Someone is also saying that it appears you are also admitting that you've all gone to sleep when it comes to adhering to the safety protocols. How then do we intensify education?
Yeah, we can intensify education. You see, sometimes there is some good part about when we see the cases going up. Everybody sees that. Say the cases are going up.
But should we wait for that to happen? Should we wait?
We shouldn't wait for that to happen. So we should have continuous education. But even with the education, some people think that it's not happening because there's nothing, because he hasn't seen it. You see, one thing about COVID-19 is that when it's very near you, then you will sit down. Or when you yourself comes positive. For example, when you take your samples for a test and you are waiting for the test result, it's worse than waiting for your A-level results. You start having palpitations. You don't know what will happen. But immediately the results come and you are negative, then you start jumping. So sometimes we forget about ourselves, and then we start all over again. So what I'm entreating everybody that let us all abide by the protocols. Everybody.
Okay.
And that's what we have.
Well, I have this one from Note. It's asking what recovery discharge criteria were used in the case of the Achimota cases. We seem to have quickly announced recovery shortly after detection.
Oh, immediately we get the results, then we start managing the patient. We haven't changed our discharge protocols. So after 7 days, without any signs and symptoms, then the patient is then deemed as fit to go back and do whatever the patient is doing. If he's sick, we continue for the patient to be well and then retest the patient. So we haven't changed anything. We are doing that. But Achimota results, you see, Achimota started about 2 weeks before people got to know about it. It was being managed.
Why were you keeping it from the public?
It wasn't necessary to, what I've always been telling people, that it's not necessary to say that we had 20 patients here, we had 30 patients here. What to me is very important now, that I will say that let's go and announce it, is when we have the vaccines coming in and then we are vaccinated. As for people getting positive, once the virus is in this country, once a while, somebody who forgets himself or has a immune deficiency or something will get infected. Do you have to come and announce it? No. Or is it because it's Achimota? Or is it because it's this? So that's how it is. So it was when the Delta variant came in, and then we then said, let people know that the Delta variant is in the community.
But does it then not feed into the perception and the talk in town that it appears that we are suppressing figures as and when it favors government, or when you think it's okay, then you tell us about it? How then do we be on our guard when you give us the need to know basis? You don't tell us as it is when you record the cases.
And if you know that Ghana Health Service website, every case which is tested and is positive, it's posted on the website.
The last is July 6th. Today is when?
That's why I kept quiet. I have even July 8th. It normally comes, today is July 11th. So it normally comes about 3 days. In fact, I have the figures for July 8, but since you announced the July 6 one, I just didn't want to.
So what's the July 8 figure?
July 8 figure, what I'll tell you is that the active cases have now jumped to 2,247. So we are going up. So from 1,982, we've gone to 2,247. So we are moving up because people who got infected the last time have not recovered. Yeah, so it's 2,247. We have we've lost 2 more patients, so it's 801 patients. We have 11 critical cases. We have 23 severe cases, and we have 94,537 discharged and recovered patients out of the 97,000. So the percentage recovery rate is about 96.9, and the daily case between the midnight of July 7th and the midnight of July 8th was 148. So that's how it is.
Okay, interesting. So specific.
And I can see.
You can finish that.
Yes, and I can see that most of the cases were from, as usual, from Greater Accra. Achimota is within Okaikwe North. The cases are coming down. We have only 3 positive cases. I don't know if it's from even Achimota. And then Ashanti region has 28 cases. And then Eastern region had 10 cases. And then we have 6 cases from Ahafo and 5 from the Buro. And then 8 cases, positive cases from the airport. So that is for the July 8.
And so when exactly did we record the Achimota case? You mentioned that it was announced 2 weeks way after it was recorded. Do we know specifically
Achimota
when?
Case started on the 16th of June.
16th of June.
Achimota, the first so was 16th of June.
Okay, 16th.
But I know the Delta variant issue started at the end of the month of June. So that's where you got to know about it.
Okay.
So that's how it is.
Okay, and it was
so if you go to Ghana Health Service website, you will see the update.
And was it government advice? Was it government's advice? Was it the Ghana Health Service advice, or was it the presidential advisor's advice that we should hold on with the announcement 2 weeks after we detected that variant at Achimota School?
No, not 2 weeks after variant. The variant results came in and we announced it the following day. Remember that the Ministry of Information said we got it, I think, the 10th. What day? He mentioned the date. I've forgotten the date. We were advised immediately the results came out in the evening. And then the following morning at 10 o'clock, it was announced by the Ministry of Information. Because the variant, because we didn't have the Delta variant as a predominant variant in the country, is now coming. We know how the Delta variant is transmissible and is very virulent. We have to let people know. So immediately it came out. But the point I'm making is that the cases in Achimota were always being recorded as cases from Okaikwe North.
Okay.
And it was on the website. As far back as on the 16th of June.
Well, we'll be wrapping up shortly, but there's one also from FA asking what's the government's position on the exclusion of AstraZeneca from the EU's digital vaccine pass, which came into effect on the 1st of July. I don't know if your attention has been brought to that. What do we know about it?
The African Union, and for that matter, the member states of African Union have taken it up. Because I call it pure discrimination. And I don't think it's the right thing to do, because the AstraZeneca from Serum Institute of India and AstraZeneca from also South Korea have all been registered, pre-qualified and registered by World Health Organization. The European Medical Authority have also knows about it. It is the same AstraZeneca, but manufactured in different places, as in the UK or the ones that they manufacture in Brussels or any part of Europe. So nobody understands why they have to say that they will not accept it. And I believe that this is how the system and the world system is. And we believe that it should be, AU has taken it up And then I know WHO has also taken it up. African CDC is working closely with WHO to make sure that it's reversed. But it's not right.
Okay. Well, in wrapping up briefly, I'm told that more and more children are recording cases of COVID-19 in the country. How true is that? What's the situation? Briefly.
I have to look at the figures critically again. I haven't looked at that in that direction. So I'll look at it again and see how many children are being recorded as positive.
And assurance.
But I don't believe that the children are being admitted.
Okay.
Because children normally have a lot of immunity and resistance to falling sick of COVID. And the percentage of children who get the COVID-19 is very, very low. So I'll find out tomorrow, and then we'll analyze the figures, and at the next time we'll tell you exactly how many children have been infected.
And in 10 seconds, the assurance is that government is still well able to manage our COVID-19 situation as a country.
Yes, nothing has changed. We are going by the same protocols that we are doing. We are going by the same strategies of moving the country together, making sure that we all follow the protocols, and making sure that we get enough vaccines into the country to achieve the vision of 20 million being vaccinated, and making sure that we learn from this pandemic, and going forward, we have Ghana, very strong country which cannot resist any, and then we can manage any pandemic which comes in the future. And we are also praying very hard that the government's vision of making Ghana a vaccine production hub in the sub-region will also materialize. Okay. That's what we're doing. Okay. But before we go, what I'll tell everybody that everybody should go strictly by the protocols. Wear your mask, wash your hands, sanitize your hands, avoid crowded areas.
Okay.
If you all do this, it doesn't matter whatever variant you have in the country, we can manage it and resist it.
We are grateful. We are grateful for your time, Dr. NSIAH ASARE. I don't know if you're supporting England or Rome, but we'll leave it here for now. Thank you so much for your company. Dr. NSIAH ASARE is a presidential advisor on health. He's been my guest tonight on The Probe. We are in extra time, but it will definitely it will stay home. And I am Emefa Pao. Have a good evening. Another edition of The Probe will come your way same time next Sunday. Thank you.